This Artificial Intelligence and Equality podcast is hosted by Carnegie Council Senior Fellow Anja Kaspersen. Together with Wendell Wallach and an international advisory board, they direct the Carnegie Artificial Intelligence and Equality Initiative, AIEI, which seeks to understand the innumerable ways in which AI impacts equality and international affairs. This episode features Ricardo Chavarriaga. It was recorded on March 30th, 2022.
Today's podcast will focus on artificial intelligence, neuroscience, and neurotechnologies. My guest today is Ricardo Chavarriaga. Ricardo is an electrical engineer and a doctor of computational neuroscience. He's currently the head of the Swiss office of the Confederation of Laboratories for AI Research in Europe and a senior researcher at Zurich University of Applied Sciences. Ricardo, it is an honor and a delight to share the virtual stage with you today.
Thanks a lot, Anja, for having me. I'm really happy and looking forward to a nice discussion today.
Indeed. Now, neuroscience is a vast and fast developing field. Maybe you could start by providing our listeners with some background.
Yes, certainly. When we think about the brain, this is something that has fascinated humanity for a long time. So the question of how this organ that we have inside our heads can rule our behavior, can store and develop knowledge, is indeed one of the great quests for science since many, many years. So these neurotechnologies, computational neuroscience, brain-machine interfaces are tools that we have developed to approach the understanding of this fabulous organ. When we talk about computational neuroscience, is the use of computational tools to create models of the brain. It can be mathematical models, it can be algorithms that try to reproduce our observations about the brain. It can be experiments on humans, on animals. These experiments can be behavioral. It can involve measurements of brain activity. And by looking at how the brain and how organisms react and how the activity changes, we will then try to apply our knowledge to create models for that. These models can have different flavors. We can, for instance, have very detailed models of electrochemical processes inside a neuron. And then we are looking at just a small part of the brain. We can have large-scale models with less details of how different brain structures interact among themselves, or even less detailed models that try to reproduce behavior that we observe in animals, in humans, there as a result of certain mental disorders. And we can even test these models using robots to tap into how can our brain construct representations of the world based on images, based on tactile information, based on auditory information. So in this computational neuroscience, we are combining the knowledge that we get from cognitive, from clinical neuroscience with mathematical tools, with our knowledge about physics and computer science as a way to better understand the brain. As I said, some of these studies are based on measuring the brain, of stimulating the brain, on manipulating somehow the brain. It can be in vitro or it can be in vivo. And for that, we use technology. And this is what we broadly call neurotechnologies, technologies that can interact with the brain, sensing, recording, stimulating. And among these neurotechnologies, we have these brain-machine interfaces. They will have a set of sensors. They can be implanted within the brain. They can be placed on our scalp and will provide us information about the brain activity. This activity is then processed using artificial intelligence methods, machine learning methods to try to extract information from that activity. This information can be, for instance, a particular state of the person. Is he sleepy? Is he less attentive? Or intentions. Does the person wants to move the hand or wants to move a foot? And when we have extracted this information, it can be used as a command to control a device. Let's imagine the case of person who is heavily paralyzed, and this is a particular condition called locked-in syndrome, where people lose control of their muscles, but retain their cognitive capabilities. These people can modulate their brain activity, they can hear, they can produce speech, but they cannot speak because they cannot move their muscles. So if we can take information about these intentions using these neurotechnologies, we can then connect it to a communication device and provide them the capacity to communicate with others. And there have been several studies in these lines. So this is one example in the realm of, say, assistive devices. We can have brain-computer interfaces used as prosthetic systems, a robotic arm, a robotic wheelchair. There are also applications in the consumer-oriented domain. So systems that can be used to control a video game, to measure the level of attention, or as a support for well-being applications. We can helping people to relax or to increase or decrease their levels of attention. And last but not least, there is also interest in military applications. So some of them include trying to identify people who can be more likely to develop post-traumatic stress disorder, having technologies to diagnose mental injuries or brain injuries, sorry, in the battlefield, or also as cognitive enhancement to increase or maintain higher levels of attention for soldiers. So these are some of the current lines of research and potential applications for these brain-machine interfaces. And here I have to say that most of these systems are currently at a research stage. So most of them are still being, say, developed and tested in research laboratories. There are only a handful of them that are now in, say, commercialization state or close to commercialization. But in the general sense, there are still many questions and many needs to properly assess their safety, their efficacy, and their performance in real life applications. So we are at the moment where the field is, say, moving from this research stage, this early age of neurotechnologies, towards the technology translation phase, and, say, trying to realize the potential of these technologies and bring it to the users. And that makes it quite exciting to work in this domain today.
I would like to follow up on the distinction you just made between in vitro and in vivo experiments. Can you elaborate a bit more on what the difference is and why it is important to understand what the difference is also from an ethical point of view?
So when we talk about in vitro experiments, we are basically referring to experiments in cultures of cells. So these are neural cells, neurons that are extracted from a brain and that are kept in a solution so that they remain alive for some time, but they are, say, detached from the body and from other brain structures. This allows us to characterize the properties of a neuron, or how a small population of neurons can interconnect among themselves, how do they react to certain interventions, but they don't provide us information about how this activity is linked to behavior or to other characteristics of an entire entity. And when we talk about in vivo, there we'll be talking about settings where we can measure the activity of the brain on a living entity. It can be an animal model, can be a human. These measurements can be done with implanted electrodes. That's, for instance, people that will go through brain surgery for epilepsy. They sometimes remain in the hospital with electrodes implanted to measure the activity of the brain and identify areas of the brain that are linked or are the source of the epileptic seizures. So this information is used to better understand the processes that are going on. Or this can also be measured with sensors that are placed on the scalp. One of the most common technologies is electroencephalography, EEG, which has been around for more than 100 years, is commonly used in clinical settings, and can allow us to measure certain activity from the brain as well. So this will be the in vivo experiments. So when we talk about brain-machine interaction and the possibility of interacting with prosthetic devices or communication devices, we are, of course, talking about the second type of settings where the person, in this case, has the sensors, but is, of course, an entire person and an entity.
Thank you, Ricardo. Listening to you talk and share your passion for this field brings me to my next question for you, and also to allow our listeners to get to know you a bit better. What, and if relevant, who sparked your interest in the brain and the vast field of computational neuroscience?
Yes, I think it's part of a long story of fascination with both biology and machines. I have been strongly inspired by my parents and how, despite not being a wealthy family, they really valued education and learning throughout the entire life. They were both, my father and my mother, they were both the first generation in their families to go to university. And at the time, among the people I knew, we were just a handful of households where both parents worked. And that somehow they embedded me this this love for improving, to looking for new opportunities, to learn about the environment and to apply it. And at the same time, I grew up in Colombia in the 90s, and Colombia is a country that has a long story marked by violence. In the 90s, it was an environment where the civil society was basically trapped between fights among the drug cartels, the right-wing paramilitary, the left-wing guerrilla, and this made me conscious of the impact of the power imbalance among these different entities, the inequality, and at the same time how privileged I was of having access to education, to have been somehow spared by most of this violence, even though no one in this environment can say it was completely spared. And at the same time, that made me think about the responsibility that we have to contribute on our knowledge to make our society a little bit better. But at the same time, it was a booming era of personal computers coming in, robotics being developed, and more exchange of knowledge and communication between people thanks to a recent innovation at the time called the internet. So it was just amazing how we could use these technologies to bring people together, to create machines that can support humans in their goals and dreams. And that led me to study engineering. I got hooked on the idea of putting biology and machines together and create bio-inspired machines. And that was my first stage. I was really interested in doing research. And at some point, I wanted to look for opportunities to expand my knowledge about biology, about science, and about the world. So I looked for opportunities and got the chance of coming to Switzerland with a scholarship. And I came thinking about artificial neural networks. It was right before the AI winter started. And this seems an extremely interesting idea for making machines that could adapt, that could learn. And when I came here, I started to look at these artificial neural networks and saw how I could also study biological neural networks. And that sounds even better. And I was a little bit this possibility of taking all the ideas about machines and then see to what extent they could apply for modeling the brain. And that's how, 50 years after my grandfather left his hometown fleeing political violence, I left mine, not due to violence, and I'm really grateful for that, but to pursue this opportunity to combine my fascination with the brain, my passion for technology, and my aspiration to contribute to society through technology.
Thank you for sharing your story, Ricardo. You and I met a few years ago in the context of your work on the governance of neuroscience and neurotechnologies, more specifically to address the lack of specific standards for developing and deploying neurotechnologies for brain-machine interfaces. Can you tell us a bit more about this work, as I think it is a helpful way for our listeners to grapple with some of the complexities entailed in providing sufficient and timely oversight and governance to the broader field of neuroscience?
Yes, so I've been doing research in brain-computer interfacing for more than 15 years. And in the early stages of my career, I was mostly focused on the technological aspects of these systems, on building better algorithms, on maybe making better protocols for that. And over time, I was seeing some advances in this area, but very slow rollout of things that could be translated into, say, realistic applications. And of course, there is a dimension of it that is that the science is hard. The brain is a system that is extremely complex, and there are, of course, some bureaucratic hurdles and studies to do so. But I wanted to know a little bit more about what were these roadblocks that the neurotechnologies were facing when trying to translate that. And this led me to look more in detail to the level of standardization. This is a work that I was able to do through IEEE Standards Association, where we started doing a gap analysis of standards for these technologies. This particular association develops standards, which is through participation of engineers, not only engineers, people that are related to the development of technology in academia, in industry, and also input from regulatory bodies as well. So when we started studying this, what the standards for brain-machine interfaces were, the first realization is that indeed a brain-machine interface is a combination of multiple technologies. So we have sensors, we have data processing units, we have robotic devices, we have other elements. And some of these elements are in themselves emerging technologies as well. So if we want to look at standards for neurotechnologies and brain-machine interfaces, we need to look at standards for AI, for sensors, for robotics, and others. And what we saw is that there are established standards for some of the sensing technologies, like EEG, some that are fMRI. There are less so for novel approaches involving nanomaterials, optogenetics. We have some standards on the use of AI algorithms in certain applications, but not that much. Standards in safety for robotics devices. But if we want to have a system that measures activity of the brain, processes this activity, and executes actions, for instance, through a robotic device, they need to be interconnected. And there was, strikingly, lack of standards for this interoperability, how to put together these technologies and ensure that they are achieving their goal. So if they are fit for purpose, if they're efficient, and not only there were not available standards for this interoperability for the specific use of brain-computer interfaces, there were also lack of standards to evaluate the performance of these systems. We have many metrics from a technical point of view to measure an algorithm, to measure a robotic device, but we don't have an integrated or an agreed framework to say if a brain-machine interfaces for assistive communication, for instance, is actually fulfilling its purpose. We can measure how many characters can someone write, for instance, but the link of this number to the actual purpose of the interface is not well established. Is that rate enough? How does it relate to the condition of the person? How does it relate to the human factors? There is still a lot of work to do. So after this gap analysis, when we identified interoperability, we identified the benchmarking as clear needs in order to be able to develop brain-computer interfaces that are, say, useful and impactful. So we have started to make projects, awareness, and in certain cases, standardization initiatives for these cases. But it's still still a long way to go to say that we have covered all the potential applications and all the potential combinations of technologies that can be used.
So if I understand correctly, whatever the application, if allowed to develop in isolation and without global standards put in place, we could potentially be faced with situations where neuromodulating methods and technologies, as well as the components used to build these systems, are simply not interoperable.
So within a single interface, we are already facing issues for interoperability and for ensuring that this interoperability is safe, is efficacious, and is secure. So in particular, if we think about scenarios where some of these technologies come from a well-regulated domain, let's take implanted electrodes, but then we'll interact with technologies that have been developed for a consumer market. For instance, a virtual reality headset or home appliances that are connected through Internet of Things. So how, and we can see that as a single system, but they will have different requirements, they will have different development cycles, and how can we make this coherent in order to ensure that there are not threats to the mental privacy of the user, so access to the information from the brain, even if the person doesn't want to reveal that information. How can we ensure that it's secure from cyber attacks, for instance?
So a neuro implant essentially to help someone who's cognitively impaired or otherwise is seeking a cognitive enhancement that is then utilizing what you said, other types of technologies. You need to make sure that those two interact both with regards to privacy, but also with regards to the technical specifications and parameters.
Exactly. So we enter into a more interconnected world where we can control lamps in our home using our phone, for instance. So we could envision in the future doing so by, say, brain-computer interfaces. So how can we ensure that the system that has access to this control command to turn on the light cannot access other information that comes from the brain? And here we are talking about hypothetical scenarios that are not a reality today, but I think it's important that we take this anticipatory stance when trying to develop the governance mechanisms and standards as well for the new generation of these systems.
Let me shift to another issue, which is important to any discussion on the governance of technology: trust. I've heard you say on a few occasions that you worry less about having technologies that can help us read minds or even accurately predict behavior, and worry more about the attribution of trust in machines and the very fact that we may actually believe that we can even read minds. Can you explain what you mean by this?
Yes, so the possibility of getting access to information about the brain to use it for interaction, of course, can create many applications. So we have talked about cognitive enhancement or cognitive training. However, these systems actually work by having a closed loop with the person, with the brain. So the overall performance and the effect that these systems will have depends on how these two entities are coupled, the artificial system and the brain. So if we only test some parts of the system, like the algorithm in given conditions, we have a part of the story about their efficacy. And we need to see what the effects are in real life and how do they depend on characteristics of the person or other ways in which the system is used. And that's what we typically have in clinical trials for the development of medical devices, for instance. So when we have systems that are developed outside this, this sector, and we think about consumer-oriented devices, there is less information about what is the actual efficacy of these systems in the real life. So there is evidence in most of the systems we see today that from scientific studies in limited circumstances that we can use electrical stimulation to improve certain cognitive capabilities, normally in short term. So, and this has led to potential applications in cognitive enhancement and an idea of using them in commercial applications, similar to identify levels of attention. And again, this led to products that are commercialized as some support for mindfulness, for better attention, or even gaming. But we still lack the actual information about what is the net effect in real life of these devices. In other words, if the claims that these systems put in terms of the benefits for the users are a reality or not. And if we don't have a proper oversight mechanisms to evaluate these effects, and we have seen that it's difficult to set it because we don't have standards for measuring this performance. So then how can we ensure that these users are getting a product that is actually fulfilling their purposes? And that's a risk. So this attribution of trust, people believing that the technology is up to a point that we can obtain that information, will open these markets, and then will make it possible to some companies to feed this information, to develop the systems that are not fit for purpose, and in the general sense, to divert our attention to systems that are not really working, that can generate backlash in the future in the public trust about neurotechnologies because we are not delivering, and hinder the possibility of developing really impactful applications.
I'm glad you brought up the ethical dimension here, because in some of your research, you look into how to improve human-computer interaction or brain-machine interfacing. I guess these words are being used somewhat interchangeably. And you argue that a key component is the system's ability to recognize errors in the human brain, which, if I understand correctly, is not an easy feat, especially not for humans themselves, and thus also prone to potentially erroneous applications. So this brings us more into the ethical domains of research.
Yeah, this is a particular line of research that I liked from the several things I've done. And one of the current ways to develop a brain-machine interface is to train the models that will decode the brain activity based on examples. So if I want to decode if the person wants to move the right hand, I'll ask the person to try to move the right hand 100 times, 200 times, 300 times, then do the same for the feet, the same for the left hand, and then I use that data to train a model, a machine learning model. But this has some limitations. First, of course, it requires the person to do that lengthy calibration process. We know that the signals that are generated are influenced by many factors. If the person is tired, if it's motivated or not, if he has learned or exercised this too much, it may change as well. So I think this kind of this way to build the models has reached in many cases its limitations, and we need to move towards other paradigms where the interaction between the human and machine is improved by actually the mutual knowledge. So if I'm using this device and I'm interacting with the machine, we can collect information that help us, in this case, from the point of view of the machine, to adapt the machine to better suit the characteristics of the person. And one particular way of doing it so was to look in the brain to responses that are generated whenever we make a mistake. And here I'm talking, for instance, if I am typing in a keyboard and press the wrong button, and then I will see the wrong letter appearing. And sometimes even before I see the letter appearing, I realize that I made this mistake, this typing mistake. And we can identify a signal that is triggered in the brain when we have that. And we also found that a similar signal appears when someone is observing an agent, in this case a robot, doing that task. If I have a robot pressing the buttons or showing the letters and shows the wrong one, we have a very similar signal. And we can decode that signal using multiple sensors in the brain. It's not a perfect decoding, but it gives us a general information of when the person disagrees with the action the robot made. So if we can provide this information to the brain, to the robot, so then it's kind of telling the robot, don't do that again in this situation. And we can teach the robot how do we want it to behave. So this can be a way to, say, complement these models that we have built before through these examples, so that they adjust over time to identify when the interaction went wrong and when did the person wants it to behave differently. We had the chance of testing this type of paradigms in very simple scenarios on controlling a robot to pick a cup from a table, for instance, or also in interactions with semi-autonomous car, where the car can provide indications on in which direction does the car thinks it should turn, and let the brain-machine interface, in this case, provide information to the car on whether the person agrees or disagrees with the suggestions from the car. They are still far from being applicable in real-life scenarios, but it shows that we could use this information from the brain, not just as a simple replacement for a joystick, which in my opinion is a quite reductive way of using the brain, but really as a channel to create a synergy between the behavior of the human and the behavior of the machine in order to achieve a certain goal.
Building on that, the issue of inclusivity is an important one in your work, making sure that the interaction with the intended user of brain-machine interfaces and prosthetics is built for purpose. However, fine-tuning the parameters is not always a straightforward endeavor, even for a brain scientist. I was hoping you could elaborate on some of the challenges that you yourself have encountered in using these technologies.
Sometimes when you're doing research, and this is actually a learning experience for me, we are so focused on technical aspects. As I said before, trying to get a better algorithm, trying to reduce the power of the electronic device. And we think that by doing it so, we will solve the main hurdles of getting information from the brain, and other aspects like the usability, the actual interface, even the packaging, will just be the easy part of translating these technologies. And when we do that, we really neglect many, many aspects that will become barriers for adoption. To make a personal example, I have dreadlocks. And even though I have been doing research in these technologies for more than 15 years, as I said, I was unable to test most of these systems, in particular those that were using electroencephalography. Why? Because the standard sensors for this modality, they don't work well with dreadlocks, with this type of hairstyle. At the time, and this is probably my own ignorance, I just put that aside. It's just basically like a funny story, or it was basically not changing my life. But in hindsight, when we take that into account and we say this is a system that is intended to be a support for rehabilitation, it be a system that is intended to be a helper for mindfulness or for well-being. So by ignoring that fact, we are basically preventing a part of the population to get access to these services. And then if we enlarge the scope of the discussion and we see how hairstyle can be a factor for differential treatment for people of color, in particular for women, these start having more implications than just being a funny story or just the fact that I just need to find someone else to test my systems. And that there was a complete blind spot on my side early on in my career. And I think this is the crux of what we are trying to do here when we are discussing how the considerations about the ethical, legal, and social implications of technologies need to be integrated early on in the design. And the best way for doing it so is by reaching out to the potential users. And I put the example of a hairstyle, but there are also examples with people with disabilities, where things like the font size, the type of a stimulus that we present can become actual barriers for these technologies to be used. So integrate these stakeholders, having this communication, this dialogue, and a continuous feedback channel can help us get better science, but also I think it can help us to accelerate technology development. Right now, there are many discussions and people who argue that these considerations, when they come too early, can just hinder innovation. And I don't think that this is necessarily the case, because if we start integrating these considerations early on in the design, this step from research to product development will become more straightforward. Of course, this requires a gradual integration on the level of detail of these considerations. It requires better training on the and involvement of different fields of knowledge, so that we don't put, say, extreme overheads early on when we still don't know many things about that. But that doesn't mean that we shouldn't start discussing it as early as possible. And as technology comes, we have, say, this double-edged sword of providing ways for people to have access to services that before they were locked out, or creating these hurdles. And we see that in particular when we look at technologies that go for the, say, the largest markets. So we think about virtual reality and how often old adults are involved in the testing and development of these systems is something to consider, because probably they're not necessarily the big market. And if we look at neurotechnologies, certain conditions like locked-in syndrome, which is people who can probably get the most benefit of these technologies, are at the same time a rather reduced market that can be considered a not viable market for the development of technology. So we need to take that into consideration. How can we make the development of these technologies responsible, economically viable, and also to create synergies between developments that are oriented to multiple populations, because probably that way we can have a larger reach than trying to say funnel all efforts in a single application or a single population.
And it stands to reason that brain-computer interface research and development is, as you alluded to, a highly interdisciplinary endeavor.
Indeed, this is in essence an interdisciplinary field, because we need knowledge about the brain, we need knowledge about how to process the signal, how to create sensors, how to interact. We need also to know how the use of these technologies can influence people, not only from a medical perspective, but also from a social perspective and a psychological perspective. We have seen with, for instance, deep brain stimulation. These are electrodes implanted in areas of the brain to reduce symptoms for Parkinson's disease, how some side effects can be anxiety. So we need to study how the use of these technologies can influence the way people live, because we can imagine someone who needs to choose on whether having the symptoms of Parkinson or having anxiety, if we cannot properly control these side effects. So how does this affect? If I'm going to have my decisions and actions mediated by an artificial system, let's say a brain implant, I have a robotic arm. I will integrate this robotic arm in my mental model of the body. So I will plan my movements according to the dimensions of this robotic arm. If it changes, I will need to change my mental model. This is something that can be learned, of course, but will that have an influence in how do I perceive myself? And what it is in a prosthetic for cognitive capabilities? If I have better memories using a given device, and for some reason it needs to be explanted, and I no longer have access to it, can I consider myself being the same person? There is a recent case of a company developing retinal implants, so systems that take images, translate them into electrical activity that is injected into the brain to produce an impression of sight, or coarse impression of visual stimuli for people with visual impairments. And this company is right now basically in economic turmoil. So the people who has these implants today are currently facing the possibility that they will no longer be able to use it. So how is this going to impact them? So we need to take all this knowledge into account in order to build an appropriate and responsible brain-machine interfaces. And this is a great opportunity because we can interact with people that have knowledge that we basically cannot dream of knowing from our own perspective, but also is extremely challenging because each domain speaks its own language. Each community has their own incentives and their own programs to develop their technology, and they are not always compatible. So this is something that is in itself a factor that is somehow changing into neurotechnology communities. But when we want to expand the the development and the use of this, we really need to go beyond that and find better ways to communicate across the borders of these silos. Not to mention people in political science and law that are also implicated as stakeholders to make these technologies available for the society.
In your view, what are some of the overlaps you see between the discussions taking place in the AI research community, especially related to the ethical considerations, and those taking place in the brain science community?
I think most of the AI challenges from an ethical perspective are directly translated for neurotechnologies, as we have technologies that will be based on data, personal data. So the inherent and unavoidable questions about bias and privacy will be applied as well for these neurotechnologies. When we look at the trajectory of AI or the field of AI in the last years, that has been basically driven by the availability of big data, we are not seeing that yet in neurotechnologies, in particular for brain-computer interfaces. And the reason is that we are at an order of magnitude lower in neurotechnologies than we are for images, for natural language processing, for instance. So there are certain areas where we are using the deep learning and other machine learning technologies for studies on neuroscience to create some models of the brain. But when we look at brain-computer interfaces and we build models to decode activity for interaction, in most of these cases, we are still using machine learning technologies that precede the deep learning approaches. So the curve is somehow different for these technologies. There are nonetheless efforts to try to leverage the advances that we have had in deep learning for brain-computer interfaces, in particular by combining information from multiple users and have a tuning for specific users afterwards, but still work in progress. In general, from a personal perspective, I am more interested in a combination of data-driven and theory-driven approaches for decoding the brain. I think is having the possibility of measuring the brain in real life gives us this, say, first on lifetime window to know how does the brain actually works. So most of the information that we have from brain activity comes from very constrained experiments. So the advent of new technologies for measuring the brain in, say, unconstrained environments, for making long-term recordings, to link that information to actions and to effect into the environment allows us for the first time in our history to better trace how the brain actually works in my daily life, and not only when I go to a research lab, look at the screen for 1 hour where I have a red dot and a green dot and I have to press a button when the former appears, which is not really my behavior. So I think the combination of these data-driven approaches can help us, say, generate hypotheses of how structures can be organized, how information can be processed, but the real power will be to link them with theory-driven approaches that can help us challenge these hypotheses and get better knowledge about our brain.
I've heard you say that many of the AI systems developed today are only vaguely inspired by how our brain works, and you have opined that that is not a bad thing. I'm wondering what you mean by that, and additionally, Being at the front line of neurotechnology development and applications, how far are we from having machines that are capable of reasoning like a human?
Yeah, well, predictions about the future are always difficult, and I think to properly answer the question, we have to agree on what is this intelligence that we want to reproduce, and acknowledge that there are different dimension or expressions of what an intelligent being does that I can or cannot reproduce with the technology today. And when we think about what these machines have been extremely successful at are cases like image recognition, cases like natural language processing, and certain games where we can identify rules, and we start expanding on certain of these tasks when these machines perform well. But we were still lacking an uniformly agreed definition of intelligence. And there are also different dimensions of this intelligence. And I think sometimes the discussion gets mixed on trying to stuck to a single definition of intelligence, or trying to mold the definition of intelligence to match our intent, being to say that we are close or far from that ideal. To be honest, I sometimes fed up with this dilemma, because it's often framed not as trying to identify what intelligence is and whether it should be a goal to replicate that intelligence, but rather to push a given agenda, either to say we have to go for artificial general intelligence or human-like intelligence, or to say we shouldn't. I think the most interesting question, at least for me, is to identify what are these intelligent traits that we want to reproduce in a machine. And this comes from a technical perspective. It can be because I want to have a better system that produces language, because it can help services in certain industries. Or it can be because I want to better understand how the representation of memories is built in the brain. And then I will go with different type of models with different decisions. Or I want to go into this minefield that is defining consciousness and trying to reproduce it in artificial systems. So I think that's for me a little bit more interesting, and it's probably the engineering speaking. Say, rather try to say, what is this thing that we are missing if we want to have intelligent machines? I want to have an intelligent machine to see it and have philosophical discussions with, because I consider my fellow humans are not worth my time for doing that, or there are not enough humans for doing it. So I don't think so. Do I want machines that can help me carry a table without needing to tell exactly where do I want to take it, do that force here, do that force there? And I would rather approach from that perspective. I'm extremely interested in intelligent machines that are able to understand some of my needs and preferences on achieving a task. It can be locomotion, it can be completing a physical activity at work, or even completing a text that I'm trying to write and point me to useful sources. And that can be, for me, a goal more valuable than just blindly saying we need artificial general intelligence for the sake of it. I think many people come to this as a way to better understand what makes them intelligent, and what is not intelligent. Other people come from more a utilitarian perspective, saying if I can have a machine that does these things I don't want to do, and I don't need to spend time explaining it for it, they will do it. Other people are fascinated with the possibility of doing it and saying I will be smart enough to create a system that will improve itself up to a point that it will become as intelligent as myself or even more. So I think there are different perspectives on that. I definitely on the side of using it as a way to better understanding the brain, but not necessarily to exceed the human capabilities, but more as a complement or a nice partner in things that are not necessarily, that I don't consider that are worth to be taken over by a human.
We tend to focus a lot on intelligence rather than what makes us human and distinct human features such as compassion, empathy, and humor.
Yes, there is a very important dimension here is that neurotechnologies allows us to measure the brain, to interact with the brain, and to influence the mechanistic processes that are happening in this brain. So when we see effects of these interventions on aspects that we are traditionally linked more to the mind or to our personality, to our empathy, to our compassion, and also to our personality, that challenges us on deciding where these different, say, phenomena and traits reside. Is this just simply an emergent phenomenon of having these heavily interconnected processing units in our heads interacting with the brain through our body, or there is something else? So there is questions that come here and that say we can start to address by using neurotechnologies. And there's probably one of these endless quests where we will always find new questions as we try to uncover the realities of how the brain mediates behavior, personality, and identity. But I think it also makes us realize the complexity of the human being and how careful shall we be when developing a system that can generate unforeseen changes on these human beings. So when we see that side effects of neurotechnologies can include some alterations of personality, anxiety, or also beneficial effects of improving attention, we should understand how this complex interaction can generate effects that are very difficult to imagine in the first place and also very difficult to control. So we are not yet at the stage where we can say, I can say prevent some effects or I can steer these processes so that they don't become what we would call maladaptive, where we can change the brain in a way that is not only unintended, but that has negative consequences for the user. So I think that makes us think on the extra onus that we have to put in our duty as engineers, as developers, as neuroscientists, as ethicists, as lawyers, policymakers that are involved in this type of technologies.
And there's been a lot of talk about quantum technologies and how that would allow us to break all kinds of parameters that have been set up to protect data in other types of systems. And you mentioned in your earlier comments this issue around privacy and also cyber safety, cyber security, even cyber hygiene around what to think about when implanting devices into your brain.
Yes, I think there is always a temptation on saying we can solve the limitations of technology with even more technology. And we can, of course, address some of the drawbacks of existing technologies, bring in new generations, bring in substitutions, but there is no free lunch. And when we are dealing with emerging technologies, we know that each of them has their uncertainties, their inherent uncertainties. Right? There are many things I don't know about the brain in itself, many things I don't know about these artificial intelligence systems in themselves, and many things I don't know about quantum in themselves. So we cannot just blindly expect that the combination of them will reduce the uncertainty. So we have to be very careful on identifying what are the lines of actions and the points of contact between these emerging technologies where I can actually reduce the uncertainty, and not just introducing a nonlinear effect where these unknown unknowns get amplified by the introduction of a new solution. So I'm generally cautious on these aspects, and I think there is probably a need to slow down things somehow. And I've had several discussions about what is the actual pace of technology development. So it's commonly said that it's going very fast, and in certain cases it is. When we take a phone that is no longer used as a phone, but as a personal computer in our pocket, and it's something that 20 years ago was basically non-existent, this is going fast. But when we think about treatments for mental diseases, where we have basically had nothing during decades coming out of the pipelines, or even on antibiotics. So we need to acknowledge that this pace of technological development is uneven, that sometimes what we attribute as fast pace of development only is referring to research and not that much on the actual impact on the field. And I have seen in this field that I know more and I love on brain-computer interfaces, how we have every 2 years a new article in the newspaper saying how a paralyzed person is able to control a device by using one of these systems. And each of these studies actually has improvements over the past one, but we are still not there yet. And this part of the story sometimes is not well discussed. How can we take these systems out of the research stage? And this involves not only the science part, but many other dimensions, so that we can say that this is actually moving fast. And here we will have again these differences between the multiple technologies. So in short, quantum can bring new dimensions to these technologies and other areas that require computing power, but it still has its own challenges in itself. So I am not necessarily holding my breath on thinking that quantum can really unlock the barriers that we have right now, because I think there are other barriers that we can address today that I will rather personally invest my energy on removing these barriers today. And if quantum appears later as a safe alternative to make these technologies even better, then it will be welcome.
So you mentioned mental health and that we made a little headway in this space for a very long time. And it reminded me of this podcast I was listening to earlier today, actually, around what they call spiritual technologies, that essentially is trying to replicate or even gamify spiritual experiences and a sense of mindfulness. My question for you also, because we're looking at these types of mental models for treating mental health issues, and you mentioned post-traumatic stress disorders, earlier in the podcast. Do you think we can hack enlightenment, or rather the neurofeedback loop that allows us to stay in the flow, which is so important for reaching a state of mindfulness?
Yes, I think it's one of the possible scenarios that where we can find ways to stimulate the person, not necessarily directly through the brain or by feedback or different types of feedback, to have improvement on certain cognitive capabilities, to have experiences that are referred to as enlightenment, or to support practices such as mindfulness. There is, though, a challenge on how can we ensure the added value of technologies for these particular practices. How can we identify the specific neural and biomarkers of these experiences, and that will also require us to have a canonical way to identify when these experiences are happening. And here is an issue that we have also in certain health applications. How can we balance the information that we get from self-reports with the information that we get from physical signals that we can measure? So I think there is a possibility. We have a challenge on identifying exactly what these systems are doing and how do they contribute for the purpose that they are being promoted to. And this comes to our earlier comment we made on how do we lack in certain applications appropriate evidence to validate these claims. And I think there is an interesting questions to develop. So because if we can get better knowledge about that, identify what of these phenomena is reproducible, is measurable, and can be potentiated by the use of these technologies, we can certainly create value for many users. And this is on one side of having this type of consumer-oriented technologies. And I'm convinced that there is space in a healthy innovation environment for this type of consumer-oriented technologies, provided that we have the appropriate means to evaluate their efficacy.
You spoke about a healthy innovation environment. I've heard you express concerns about what you have referred to as celebrity tech leadership and the crowding of all communication channels, social media in particular, with headline-grabbing sensationalist applications of neuroscientific innovations.
Yes, I think it's very important to be aware of the narratives, and for the general public, sometimes it's difficult to understand what these narratives are, what are the role of different stakeholders in the development of these technologies, and the real state of the art. And we have had, say, for many years, this figure of the lonely genius, of the person that drives the advancement of humanity. We can imagine figures like Thomas Alva Edison, or the fact that Nobel Prizes are attributed to a single person, even though there are a whole team involved in that. And I think right now we have a little bit of this in people that appear as disruptors that have been successful in certain areas, and that have a platform to express their opinion, sometimes their interest in things in several topics. And we know that we, as humans, are very prone to a cognitive bias that is referred to as the halo effect. Is that when we have a positive impressions of people on one area, we tend to be influenced that this positive impressions also translates to other areas, and the trust that we put in these organizations or individuals somehow gets generalized to all the information that they provide. And right now, with say internet, social media, and other means that can ideally democratize the participation in public discourse, what we see is that attention can be focused on, say, a limited number of individuals who already have a platform and can really have a strong influence on multiple areas. And sometimes what we have is that the opinion of these experts that come from a single perspective, so don't give the entire picture of how things have been developed or how far we are. There is, of course, interest sometimes from in the innovation sector to attract investment, to show that we are moving ahead, and there is no lack of enthusiasm on the development of these products that can drive these narratives. And also we have a simplification of very complex arguments and say systems that are complex, processes that take time, get often expressed as if they could be shortcut. And this creates a risk because people will get unrealistic expectations about what these technologies can deliver, when they can deliver, and to whom they can deliver. And that's what brings me a bit cautious about how the discourse is not including all the voices that we have. And there are voices, of course, that come from experts in one field that not necessarily contributing to the entire discussion in other fields, and certainly sectors of the population that are not having enough space in these discussions. And I think one last point that makes me worry about this kind of leadership that simplifies the message, that sometimes is marked by some techno-optimism that we can again solve problems of technology with even more technology, is on one hand they hide, this message hides part of the complexity. We saw it with COVID-19, for instance. The fact of having the vaccine, which is basically a tremendous achievement for the scientific community, is not enough. We need to have the means of production. We need to have the distribution chain. We need to have the public health campaigns for awareness to reduce reluctance in order for this to actually be efficient. So, and if we only focus on one part of the story, we don't give attention to these other elements that are also necessary for achieving our purpose. And the other part is that the discourse, when we talk about technology and other areas, tends to hide the uncertainty. Arguments are presented in a factual manner, and the certainty of the delivery and the benefits of these applications is just taken for granted. And we know that science and the way society works is just filled with uncertainties. And if the public discourse is less and less used to talk about uncertainty, and people who discussed about different possibilities and different alternative scenarios are not being trusted because they are considered that they are not confident enough, they are not expert enough, then we are losing a way to communicate effectively what we know from science and how science and technology can actually contribute to address the societal challenges. So in a nutshell, we need to have a communication platform where all the voices can find its space, where we can communicate about the things that we don't know. We can find ways to get this knowledge, and where we don't oversimplify the message. And we recognize that we are dealing with complex problems, that we don't know everything about it, but we are aware of it, and everything that we do is intended to get better knowledge about it and better solutions to these challenges.
And in responding to those uncertainties that you just alluded to, I noted that the vision statement of the organization that you lead, CLARE, is to provide a blueprint to steer AI as a transformative force for the benefit of all. So no small task, in other words. And I've read somewhere that you aspire to become essentially a CERN for AI. Do you feel that we are making headway on this and actually able to create that environment that you were referring to earlier, where we both address the uncertainties, the promise, the peril, and also avoid tech solutionist approaches in responding to both the potential, but also the challenges these technologies represent and will continue to represent?
Yeah, I think there are promising signs that we are moving in the right direction. So that does mean that everything is perfect, but there are an increasing acknowledge of the need of a multi-stakeholder involvement for the development of these technologies. I have heard all my life about the need of breaking silos, and the reality is that the silos are still there. So we need to find better ways to move across these silos, to get out of our comfort zones, and have these spaces where the researchers in academia sit with innovators and policymakers, ethicists, and others to identify how these technologies can really contribute and impact society. There is, of course, a need of a very strong research environment and in a, say, efficient innovation landscape as well. So that speaks about a need to engage with the political actors to promote the public investment on these technologies. So that is, we find a right balance between the private and the public sector on the development of these technologies. It's something that that is probably not very well balanced today when we look at certain organizations that have a significant amount of power regarding not only their economical situation, but also the access to data, the access to resources. So there is also a new generation of people looking at technology that are more open to address these ethical concerns, the social implications, and to look at these technologies not just as a magic wand that I can develop in my laboratory, disconnected from everybody, and after my eureka moment, just publish it and having it on internet, and the world will be a better place just by snapping my fingers. So I think there is more awareness of that. There's still a lot of work to do in this aspect, but I think there is a new generation that starts looking across these silos and considering it something that is worth spending their time and their energy, and not only in the pure technical aspects. There is also a kind of realization of what these technologies can do, but not with blind optimism. So there has been all these ideas of technology to address the main global challenges. Some people talk about existential risks and how technologies can contribute, but there is a more critical look at it than it was 10 years before or 5 years before. And I think this is a good seed to start steering efforts in that and to work in a common way. And another part that I think is interesting, and it relates to your question about what can we learn about CERN, is there is also this idea of a need for being bold, to have large-scale projects that by definition require collaboration from multiple sectors, and projects that of course, have a vision of what wants to be achieved, but are also useful to produce derivative products that will spill over to society. And we had it with the space exploration. We had it with the accelerators in CERN. Well, the usual example is the World Wide Web, but there are many others that that come out of that. That I don't need to be interested in particle physics for benefiting of this. And I think this realization is again present today, and we need to leverage on this idea of being bold, sometimes driven by a sense of urgency that we need to use technology for the benefit of all. So we need to leverage on that, being cautious, because I don't believe, and this is something I heard in one conference that I like a lot, that it's not good that we put technology in the critical path for survival. It's an element that contributes that, but it's not that technology is going to save us. What saves us is how do we integrate technology in all the economical, social, political, and ethical frameworks that we have. But we are at the right time for doing it. So there is awareness, there is the intention from a significant amount of people. There is probably not yet a general agreement on what is the right strategy, but I think this is something that we can work on and that we can definitely do it, and that I'm convinced that we have to do it because our future depends on it. There is the issue of the reproducibility and the issue of what is the approach that we have to science. And then somehow when we see the way the daily life of scientists is and what the incentives are, I will say that some of them are really against the purpose of science that challenges itself. Because I mean, it's unrealistic to pretend that every scientist will have a breakthrough, that every discovery is new, and that every single paper that is published is changing the knowledge or advancing the knowledge. In that sense, we have like high aspirations that somehow make some noise in the science that we produce. And one issue of having metrics is that once you know the metrics, you can try to game these metrics and rig the game. and I think sometimes this leads into the type of science that we do, that we focus on low-hanging fruits, that we devote all the attention in certain areas and leave aside others that are more risky or less trendy. So I think there's a need to clean up our work there. I also think that there is sometimes a conflation between what is the basic science and applied science. In particular, when we talk about translational research, I've seen many works that are presented as being translational, but are developed with a mindset of basic research. And in the sense that they don't necessarily consider the translational aspects of taking things outside of the original research state, or extending to other potential type of users. For instance, sometimes we have, or many times we have studies that are in the long run intended for assistive technologies, but in early stages are tested with control subjects, with people that have no motor disability. So the learnings that I obtained from these studies, which are valuable, but they are still not enough to be able to do this translational phase. And we need to provide the means to do these translational studies. And this includes training, resources, and support. We need also to properly identify which stages are required. Sometimes we have incentives for the very early stage research in these emerging technologies, but not enough for the development, because it's no longer considered as a scientific endeavor and is not mature enough to interest investors for development of a product. So we create a gap between these two where many potential ideas will fall through. And this is part of having a better environment for promoting this science. And we need to put all this together. We need to identify who can support these different processes, what requirements do we require or are needed, and also how can we properly learn from others when we have, say, studies that are not reproducible, when we have information that is not complete or is not shared. We cannot take the collective knowledge and the collective intelligence of the scientific community one step forward. And if everybody tries to push in a single area or for its own agenda, then we are preventing this this effect of the collective intelligence of the scientific community.
And naturally, when we think about ways of controlling the mind and understanding our brains, there's one word that we haven't discussed that comes to mind, which is that of power. What are your thoughts? Do we need to rethink ethics in providing the right type of oversight to developments in this field to make sure that power does not fall in the wrong hands or are used in ways counter to our purpose?
Yes, evidently the possibility of having functional brain-machine interfaces for mental surveillance, for mental manipulation, or as simple as providing a very efficient way for interaction or for our well-being will provide a significant amount of power to those who develop it and those who commercialize it. And if the area of data science and artificial intelligence is something to go by, we see how the private actors can gain considerable power in discussions about that, in the implementation and the existence or not of appropriate oversight. And since neurotechnologies will have say a tight link with this data power industries, we can foresee a future where private actors gain as well access to more power or increase their power by the possibility of using these devices. That's of course something that we need to be careful on. What are the uses? What are the required characteristics of these systems? So in terms of the protection of human dignity, in terms of their provisions for equity, and how the channels of distribution will be managed. This, of course, is something that, in order to be useful, needs to be done at an international level. So here, I don't see how can we expect a single national legislation or governance framework to have enough impact, because we are talking about a global market here. And there are different, so I mentioned one aspect, which is this power imbalance between the private and the public organizations. There is another, which is the difference between those countries that develop the technologies today and those that are more likely to become consumers of the technology. And there is, of course, an economical power that comes there. There will be probably a source of influence coming with all the technological global landscape that can lead us to a world where nations are aligned with their technology provider, and cybersecurity threats is a major driver to create a cleavage between these different types of alignments, and this will, of course, impact the adoption of neurotechnologies. There is another aspect, is that if we don't consider the aspect of inclusivity when we develop these technologies of the brain, we can end up with systems that are based on the knowledge we have about the brain from a limited percentage of the global population. In one word, we will have systems and models and treatments for mental health that are based on the knowledge that we have about brains from people in the US or the EU or in China, and less from the global south. So how this will affect the efficacy and fitness for purpose of these devices, something that we can and need to address today. And this, of course, is one aspect that affects this other dimension of power imbalance that we may have. And of course, there can be other type of unintended uses of these technologies if they become more easy to access, even do it yourself. So can this empower certain actors to use them for malicious purposes? And this is something that we need as well to be cautious about. I think many of the problems that we are seeing right now with technology came from the a wish of having more and more technology that is frictionless, and that makes us unaware of the cost that they have, of the implications that these technologies have, and makes us a little bit reckless on the use of technology.
Thank you, Ricardo, for sharing your time and expertise with us, your passion for ensuring that this pivotal area of science receives the attention it deserves. This has been a gripping and insightful conversation. Thank you to our listeners for tuning in, and a special thanks to the team at the Carnegie Council for hosting and producing this podcast. For the latest content on ethics and international affairs, follow us on social media at Carnegie Council. My name is Anja Kaspersen, and I hope we earned the privilege of your time. Thank you.